But what we're going to do this morning, I'm going to try to get you a framework to think about addiction in. So understand what is the problem, what does it look like, and what's some of the underlying biology. What I'm hoping to give you is a framework, a model for understanding what these drugs do, how they change the brain, and where we have treatments and also just sort of natural events, places where we can intervene in those brain processes to change outcome. And I think hopefully you'll all leave sort of understanding enough that you could come in, think about where people's problems lying, what are some of the issues they may be dealing with, and where could you effectively intervene in order to shape trajectory over time. So addiction is one of those things. It doesn't come on immediately. It also doesn't go away immediately. So there's always things you can do to increase or decrease likelihood of in the course of the disorder. After we have that framework, we'll go through, I'll talk about what are effective treatments. What do we know works? What are examples of medically proven treatments, and what do they do and how do they fit within that same framework? I'll talk a little bit about the known risk factors for substance use disorders and ways that you might be able to modify those, how those have been used sort of inside and outside of treatment to help people. I'm going to spend probably more time than I used to talking about potentially addictive drugs and their use as medicine. I'll note that, I think for years and years, illicit substance use was the most concerned problem. So people were worried about methamphetamine and cocaine and heroin. I will say right now, those are a very small component of the substance use, just the illicit substance use that we see right now. That most of the drugs that are being used and misused and the substance use disorders that are being developed are around drugs that are used as medications and potentially misused as well. So there's a very, very complicated balance that I do not envy either patients or providers in trying to sort out. And so what I'm hoping we can do in this section is get a sense of both how to balance risks and benefits of some of these potentially addictive medications or drugs that could be used as medications, and how you can reduce risks as people are trying to use them clinically. So this is just where I'm just showing, I'll bring this back in just a second, but the neurons that we're talking about, or we're going to be talking about, are these dopaminergic neurons here that are found in the extended amygdala and the ventral tegmental area. They project up to a part of the striatum, part of the ventral striatum known as the nucleus accumbens, again, very famous brain region that's involved in choice and initiation of habitual behaviors. This system then talks to other parts of the dorsal striatum, other parts of the striatum, and your caudate nucleus, all of the parts of your brain that encode habit behaviors, all the things that you've learned how to do without thinking about it, right? Like I can drink my tea and still listen to you without getting distracted, right? My brain has a pattern in there on on drinking tea that I can carry out without any cognitive awareness that I'm even doing it sometimes, right? All my fidgety behaviors, which you may have noticed already, same concept, right? So all of those patterns are in the caudate. The nucleus accumbens essentially is provides the choice and the brake on doing those, right? So it listens to these neurons, in these dopaminergic neurons that tell it about opportunities, makes a choice whether to take them, and if it does, it just kicks off that habit program. It says, go ahead, do it. And that, as you note, here's your cortex up there. That's the part you're consciously aware of. This is underneath that. You will do all these behaviors. You may only catch yourself doing them consciously after they're done, right? Like I can go back and be like, oh, I just drank some tea. I wonder why I did that. I may make up a reason why I did it, but that reason may have nothing to do whatsoever with why I did it and what came out. And you'll see that sort of behavior, that sort of rationalization happens a lot in addicts, and I think people tend to believe them too much when they ask them why they did it and they get an answer back.